Dr. Riddle, I don't know if you can hear us, but we can't hear you.
Dr. Riddle, you're muted. So if in the bottom left corner, you just
There we
hit the
go.
unmute button. There we go.
Got it. So as I was just saying, I want to thank you for welcoming me to do this presentation today. And I'm going to try to cover for you as much information as I can to answer questions that you may have about the COVID vaccine. And we'll also cover some general topics about COVID and try to answer any questions that you may have about that. Certainly, there's been a lot of uncertainty about this virus and the illness that it creates. We crossed a milestone today where our 500,000th American died today from COVID. So this has certainly been a challenge for us, and hopefully going forward, better days are ahead. Just to start to get into the discussion about the vaccines, I don't think a full appreciation about the vaccines can be attained without having a full knowledge of how the vaccine works. And in order to understand how the vaccine works, I think it's important to first understand how the virus works once it penetrates your body. The virus gets into your body through very limited means. It can either get in through your oral cavity or mouth, or through the nasal cavity, or through your eyes. And once the virus enters your body and starts to circulate, it will look for cells that it can invade or get into so that it can basically use your body's DNA and RNA to replicate itself. And these viruses will then start to replicate themselves in large numbers once they get inside your cells. And they continue to do this until your cells just can't take anymore, and one by one start to die off. So the key thing in understanding how the vaccine can work is to understand that the intent of the vaccine is to disable that virus so that even if you were to inhale it and it got into your circulation, it would not have the ability to penetrate your cells so that it can replicate. And in time, that virus would then die off, and then your body would be able to get rid of it. Now, one other point that we need to understand about the virus before we start to get into discussion about the vaccine is the transmission. How does this virus transmit itself from one person to another? And I know, we know this is a respiratory virus primarily. We know that it can also survive on surfaces for a period of time, so that if you were to touch a contaminated surface and then bring your hand to your mouth or to your airways, that you could then transmit the virus internally. We those don't always have a good understanding of exactly how this virus can transmit from person to person. And I think sometimes this leads to some misunderstanding about how a mask works and how effective wearing a mask can be, especially when it's effectively covering your nose and mouth. So let me give you a few examples. If I am just talking to you, that is enough for me within a 6-foot space to aerosolize particles that can contain the virus. And once I aerosolize those particles, those little tiny droplets can actually stay suspended in the air for several minutes after I talk. So that's why it's really important to maintain a 6-foot distance from each other. But it gets even more complicated than that when you think about a person who actually has the virus that is causing them to cough. When you cough, the particles that come out, if you don't have time to effectively cover that cough, can travel as much as 18 feet away from you, and can travel those 18 feet in as little as 3 seconds. And on top of that, those particles can potentially stay suspended in the air for up to 7 or 8 minutes. Now, here's the one that's really surprising, and this is where if a person has the virus sneezes. Because when you sneeze, and if you don't effectively cover that sneeze, The particles that leave your mouth that can contain the virus can exit your mouth in excess of 90 miles an hour and have the ability to travel up to 200 feet. So even maintaining a 6-foot distance from each other isn't going to protect you from that kind of transmission through the air. And that's why it's important not just to maintain distance, but also to effectively cover ourselves with masks and to wash our hands as often as we can, or at least sanitize our hands with a good hand sanitizer. The next question, though, is around symptoms, because as I'm sure many of you are aware, not everyone that gets COVID develops symptoms. And then for those who do develop symptoms, some get pretty mild symptoms. It turns out that for every person that gets COVID, the subgroup that develops symptoms, 8 out of 10 will only develop very mild symptoms, not much more than a cold. But 1 out of every 10 will develop moderate symptoms where it's going to have them sick enough where they can't go to work, maybe can't get out of bed for a few days. And then the other 1 person out of that 10 is going to be sick enough to go to the hospital, potentially require intensive care, and potentially even die. So let's talk about this group for a second. Why is it that some people get symptoms while other people remain asymptomatic? And it turns out that the symptoms that we see people get aren't necessarily the virus, but more our immune system that's responding to that invasion of our bodies with the virus. The symptoms that you get typically come out about anywhere from 2 to 14 days after you've been exposed to a person with COVID. And those symptoms can be very widespread. Typical symptoms are things like cough and fever, and headache and body aches, many symptoms that might seem very similar to the flu. But then we get these atypical symptoms, of course, where people can lose their taste of sense, of smell, or the taste that they can have. And a lot of patients develop GI symptoms. Some only develop eye symptoms where it might seem that they have an eye infection. So we've seen a wide variety of these symptoms that occur, but the virus does seem to have a preference for attacking your respiratory system. So then why is it that some people get symptoms that are so much worse than others amongst those that do get symptoms? And it turns out that, again, the severity of symptoms aren't necessarily due to the virus effect on the body, but much of it comes from our own immune system and how our immune system can actually start to attack our own body in trying to fight off the virus. Now, I don't know if many of you are familiar with the term cytokine storm. It turns out that a lot of individuals who do wind up sick can actually, once they've been infected, get through that first week and come through pretty well and not feel that badly. And then all of a sudden, somewhere between day 5 and day 8, they crash. And then we wonder why. And it's been recognized that when your body is fighting off this infection, it can develop a cytokine, and a cytokine is part of your immune system. And there's cells that basically go to the point of an infection and try to kill off the virus or the invader into your body. But it becomes much like in COVID for some, I'm gonna reckon it to a fire department that is called to put out a fire. And the firemen come and they find that fire and they put water in the fire and they put the fire out. Now, in the normal circumstances, that should be the end of your response to the fire. But in cytokine storm, even though the infection is eliminated, the cytokines don't turn themselves off, so that It would be like a fireman continuing to hose down that fire even after the fire's been put out, to the point where, okay, you put the fire up, but now you put so much water in there that you flooded out the remaining structures that were intact before you got there. And that's what happens with these cytokines. They kill off the virus, but then they don't stop and they continue to react. And now they start to attack your own body, your heart muscles, your lungs, your kidneys, your blood vessels, a number of other organs in your body start to get attacked by these cytokines. And this is what causes a lot of the severe illness that we see with COVID. So now that I've given you all of that background, let's talk specifically about how the vaccines work. First, let's review a couple of key points about the vaccine that I think it's important for us to get out of the way. The first is that all of these vaccines have been put through a lengthy, rigorous testing process to make sure, number one, that they work, and number two, that they're safe. And this is very important. The other is that the two vaccines that we initially had available to us, that from Pfizer and from Moderna, are both made from a technology that involves replicating mRNA, which is part of our genetic makeup and the genetic makeup of this virus. Some people that I've spoken to said that they didn't want to have the vaccine because this mRNA technology was relatively new and hadn't been tested. And though we are seeing mRNA vaccines being used for the first time with COVID, these vaccines, this method of creating a vaccine has actually been studied now for many, many years. So even though it is new in terms of it being used, it's not a new technology. It is something that has been well studied. The next is that these vaccines do not contain live or even dead COVID virus, so that there is no way that receiving the vaccine can cause a viral infection in anyone who receives it. And finally, the fact that these vaccines deal with mRNA, at least these first two vaccines, in no way means, because of the way they work, that they're going to interfere with your existing RNA or DNA or your existing genetic material. So you should have no fears around that in making a decision about whether or not you will consider getting the vaccine. So the first two vaccines, as I mentioned, were those from Pfizer and Moderna. And full disclosure, I actually was a recipient of the Pfizer vaccine. I received my second dose back on January 13th. So I'm several weeks past now that second dose. And I'll talk to you about some of my experiences with it in a second. But when we talk about these two vaccines, first of all, Pfizer and Moderna are both 2-injection vaccines. They both require you to finish out your series with what you started. So if you start with the Pfizer vaccine, your second dose should also be a Pfizer vaccine and not the Moderna. And likewise, if you receive the Moderna vaccine first. The separation, the timing between the two is important. With the Pfizer vaccine, you'll be getting the second dose 3 weeks after you get the initial dose. With the Moderna, you'll get your second dose 4 weeks after you get your first dose. Some people ask, well, if I am unable to keep my appointment for that second dose, does that mean I have to start the whole series over? And actually, there have been some studies that have already looked at this and have found that if you miss your appointment for any reason, you're still safe in both cases with both vaccines to get that second dose up to 42 days after you receive the first dose. And that will be fine in terms of your completing the series and getting immunization. Both of these first two vaccines work particularly well with a 94% efficacy for the Pfizer vaccine 95% efficacy for the Moderna vaccine. Now, there are several other vaccines that are on the horizon, such as the Johnson & Johnson vaccine, which though it has an efficacy rate that's a little bit lower than what was seen with the Pfizer and Moderna, it's a single injection vaccine that doesn't require the deep freezing levels that were initially required for Pfizer and Moderna. That actually recently changed. But the fact that it's a single dose vaccine makes it more convenient to take. And one other thing to point out about particularly the Johnson & Johnson vaccine, and this is around the discussion that has been had with the various variants that have been seen with COVID. There has been testing done with the Johnson & Johnson vaccine that shows that it is in all likelihood about 85% effective with some of the major variants that have been seen to date so far. Now, does this mean that the Pfizer vaccine and the Moderna vaccine are not as effective? And the answer to that is kind of simple. The first point, and something you need to remember, is that because Pfizer and Moderna vaccines came out early, it's not that they're not effective against these variants. It's just that they came out so early that when they first appeared on the market, these variants were not in place yet. So that the clinical trials did not knowingly include people who had these variants to be able to test the efficacy of the vaccine against these variants. A little different with Johnson & Johnson, which was able to capture people who took the vaccine who actually were identified as having some of these variants. So I wouldn't worry so much about the variants. And I'll tell you something else. When you look at the level of antibodies that these vaccines produce, which we'll talk about in a few seconds, the level of antibodies produced by the Pfizer and the Moderna vaccines were so high that even if they were somewhat less effective in fighting off the variants, the antibody levels were so high that by sheer volume, you overcame the lower level of effectiveness, and you were still able to show good efficacy against these variants. So it's pretty safe in terms of the variants to take the Pfizer, Moderna, or any other vaccine. And this comes into play when you start to think about the fact that there are a number of vaccines, and you might say to yourself, well, which vaccine am I going to choose for myself? At first, you might say, well, I want the one that's going to be 94 or 95% effective. But then you might say, well, I want the one that's been shown to be effective against the variants. The bottom line is this, that your choice should be based on whichever vaccine is available to you first. The last situation you want to be in is one where you had an opportunity to get one of the vaccines, but you held off on getting it because you wanted to wait until the vaccine of your choice was available. And while you were waiting, you contracted COVID. That would be a pretty bad circumstance. The other thing to remember is that these COVID variants rely on transmission in order to create more variants. So that the quickest way to deal with these variants is for all of us to get vaccinated as soon as possible. Now, let's spend a few minutes talking about what happens on the day that you receive the vaccine. So on that day, you'll fill out a consent form. You'll also be asked a series of questions in terms of whether or not you've already had COVID, whether or not you're having symptoms of COVID on the day of that vaccine. You'll also be asked about any allergic reaction history that you've had and any sensitivity that you have demonstrated in the past to any vaccine that you've had up to that time. Very important for you to answer all of those questions as accurately as you can. You'll then receive your injection. You'll be monitored for a period of 15 to 30 minutes to make sure that you don't develop an immediate allergic reaction to that vaccine. And then you will be able to go about on your way and enjoy your life at that point. And after completing your series, you will receive a vaccination card to show that proof that you've had that immunization. So then the next question becomes, what about the allergic reactions and what kinds of side effects can you expect? So the allergic reactions are going to be the same type of anaphylactic type reactions that you can have to any vaccine or anything that you're allergic to. And that's why it's really important when you're filling out your questionnaire to accurately enter any information you can about any allergic reactions you've had in the past. In addition to that, there's a number of adverse reactions that can occur beyond that first 30 minutes, usually occurring within the first 72 hours after the vaccine, with the most common side effect being a little bit of soreness that you'll get at the injection site. Usually that soreness starts to emerge about 10 to 12 hours after you've had the vaccine, and it tends to go away after it's been there for about 24 hours or so. And it's a pretty mild reaction that you can get, although I have seen a couple of patients that have reported to me having what is now been termed COVID arm, where they get more than just the soreness at the site of the injection, but they can also get soreness and maybe even some swelling throughout that arm where they had the injection. Again, that tends to go away after a couple of days and can be effectively treated simply by using some local ice and also some local anti-inflammatory agents like Advil, let's say, or Motrin, or even Tylenol. Now, this actually starts to get into a really important point, because I've already heard people say, well, with these vaccines, I've heard that if you take the vaccine, you shouldn't take Motrin or you shouldn't take Tylenol because that can have an impact on the effectiveness of the vaccine. That is actually a myth that is not true. If you take these medications for side effects, it will have absolutely no impact on the ability of the vaccine to work, though the CDC did put out a recommendation saying that anyone who is going to take the vaccine should not take medications like Motrin or Tylenol proactively in anticipation that they might get a side effect. Just wait until you get the side effect, and then you can take these medications safely without worrying about the efficacy of the vaccine. The next question I want to touch on is who should and who should not receive these vaccines. So obviously, if you have had an allergic reaction in the past that has been more of an immediate type of an anaphylactic reaction, where you've had any level of discomfort with breathing, you want to have second thoughts about potentially taking the vaccine and talk to your physician who knows your history about whether or not you should take the vaccine. There's a number of other groups that we should spend a few minutes talking about, though. So the first of these groups would be anybody who has had a previous COVID infection or even a current one. Is it okay for you to take the vaccine? And the answer to that is absolutely. You should take the vaccine even if you've already had a COVID infection. The reasons why are that with an infection, you can get some level of natural immunity, but we're not exactly sure how long that immunity will last. And the amount of antibodies that you will develop will be greater or lesser depending on the severity of the infection that you had. Whereas with the vaccine, you're guaranteed pretty much to get pretty high levels of what's called neutralizing antibodies that will protect you from a future infection. The key thing, though, is that if you actively have a COVID infection, you want to hold off until after that infection is cleared up, obviously, and you've been cleared from quarantine before you take the vaccination. And an additional point that's been brought up by the CDC is that if you've recovered from a COVID infection, you perhaps should wait about 90 days before you take the vaccine, because the risk of being reinfected with COVID is extremely low in the first 90 days after you've had an infection. The next group are those who have had a vaccination for some other reason. Now, we're already well into flu season, but this time of year, you still have people that are getting influenza vaccines, and in the interim, you may be getting vaccines for a number of other reasons. So if you are getting another type of vaccine, you should separate that vaccine from the COVID vaccine by a minimum of 14 days. And the reason you want to do this is because if you do develop an allergic reaction when you're taking the COVID vaccine, you want to make sure that you haven't had another vaccine within 14 days that may have contributed to that allergic reaction that you're having. So that 14-day separation becomes very important. Next is the group who had a COVID infection and either received a convalescent plasma or antibody treatment for COVID. And for that group, it's recommended that you, again, wait 90 days past completion of those treatments before you take your vaccination. Anybody who has had a potential exposure to someone who's had COVID, where you're not sure if you might have been infected or not, as long as you're not being quarantined, it's fine if you get the vaccine at any point without delay. And in fact, that may help you in the case of having had a recent exposure. If you've got an underlying medical condition that's known to put you at increased risk for COVID, that in no way interferes with your ability to take the vaccine, and you should take the vaccine as soon as it is available. If you have an immunocompromised condition, such as, for example, lupus or severe diabetes with complications, there's no contraindication to taking the vaccine, but you should talk to your healthcare provider prior to making an appointment to have that vaccine given to you. In terms of pregnancy, if you are currently pregnant, it is not thought at this time that the vaccine will do anything to disrupt that pregnancy or trigger premature childbirth or cause any type of birth defect. So in a situation of pregnancy, I would again advise you to speak to your healthcare provider to make a final decision. But as far as we know about the mechanism of how mRNA vaccines work, we don't believe at this time that there's any issue with taking the vaccine if you are pregnant. And this is, by the way, being studied at this time just to make sure. In addition to pregnancy, women who are breastfeeding should feel comfortable at this point that current data does not show us any evidence that there's anything in the vaccine that will have a negative impact on either the quality of the breast milk or the ability of the mother to produce enough milk to provide nutrition to their child. After you receive the vaccine, you may wonder, how is this going to change your life? And the bottom line is that we are still, at least for the foreseeable future, going to have to continue to do the things that we have been doing up to this point to protect ourselves, such as wearing a mask, social distancing, and washing our hands, and the other precautions that we take. It's going to be at the point where enough people have either a disease-generated immunity or a vaccine-generated immunity that we get 70% approximately of the population to have antibodies, that we can then say that we have herd immunity. And hopefully at that point, life can start to return to normal. But unfortunately, keep in mind that normalcy may be different in the COVID era, where it may just be that we're going to have to continue to wear masks for at least some time. And many of the safety measures that we put in place may actually be here to stay in some way, shape, or form. So it remains to be seen what normalcy is going to look like once we get to the point of having more people vaccinated. In terms of when you can expect to get that vaccine, I would watch very carefully for when there is availability. As we get more doses of vaccines available, there's going to be broader availability for everyone to get their vaccine. And again, I would encourage you to get that vaccine as soon as possible. Let me just close out with one more point and address what I refer to as the elephant in the room. And that is, with these vaccines, how well are they really going to protect me in the long run? Will I need to have a booster? Will I need to have a booster because the effectiveness of the vaccine is going to wear off over time? Will I need to have a booster because of the number of variants that are forming? So the quick answer to that is that once you've had your vaccination, you'll reach a point of peak immunity approximately 2 weeks after you've completed your dose. And the feeling is that that protection will last a minimum of 3 months. And we're still studying to see how much longer beyond that that protection will last, to figure out if and when a booster shot will be required to keep your antibody levels up to a level where they will be able to protect you. So there are still many unanswered questions. But again, even with the uncertainty that we have, I highly recommend that you receive one of these vaccines as soon as that you have availability of it. I'm going to stop at this point and turn it back over to Lindsay.
Thank you, Dr. Riddle. That was incredibly informative, and we appreciate your time. So that was the first session. And before we close out, I just want to have Sheila Wilner read a poem that she wrote regarding the pandemic.
Hi, everyone, and thank you for joining us today. We hope to bring you lots of Zooms that are very informative. We're hoping for every 3 weeks to a month, and it's going to cover a lot of different subjects, particularly lifestyle medicine, because as Lindsay said, you get old, but you don't have to be old. And there have been many researchers and doctors that are proving this on a daily basis. So at King Street, we really try hard to keep our patients young, and we try to keep them as healthy as we possibly can and as vital as we possibly can. And there's no reason why everyone who is going through the aging process, and that is everyone, that they can't be strong and vital as well as they age. So we hope to bring you some very interesting programs. I myself just have a little hobby of writing poetry, and particularly now with the pandemic, I've been writing a lot because there's a lot of emotions that come up with the pandemic for everyone. And I found that this is a good way for me to release some of these emotions. So today I'm going to read one of my poems, which is The Vaccine, An End in Sight. And it seems relevant since Dr. Riddle just informed us all about the vaccination. So this is how it goes. I never thought I would allow myself to take the vaccination. But as I listened to the news each day, I was shaken by the deaths across the nation. My friend's husband was living life when COVID took him by surprise. Respirator, organ failure, in the blink of an eye, he dies. It's like without any notice, you wake up one day and the virus says, I choose you. You begin to fight the battle, but there's not much that you can do. There's some hope now since the approved vaccines are being given. We hope that herd immunity will change the way we're living. Some are still reluctant, fearing side effects and more. Regardless, we have a responsibility. though it scares us to the core. After more than a year of hospitalizations, loss of jobs, depression, isolation, people going hungry, and businesses about to fold, the vaccine will get us out of this. At least that's what we've been told. So let's visualize and pray for a future that will be brighter. The vaccine has given us hope that the coming days will be lighter. And with that, I'll say thank you very much for joining us today, and we hope that you join us for further Zoom calls. Stay well, stay healthy. Thank you. Bye-bye.
Susan, did you want to ask a question? You have to unmute yourself.
Hi, Dr. Riddle, I sent it in the chat. I don't know if you could see it, a couple of questions.
Okay, so I have here, can you clarify again how long the CDC is saying they think the vaccine lasts? So at this point, they're really not sure, but what they have said, and this actually applies to healthcare workers specifically, is that if you come in contact with someone who has COVID, in the past, and let's say you're not wearing an N95 mask or one of the approved masks that will protect you in that situation. In the past, it would have been necessary to put that healthcare worker on a 14-day quarantine to make sure that they didn't develop symptoms from that potential exposure. So since the vaccine has started distribution, the CDC updated that guidance for healthcare workers to say that if you've had your vaccine and you find yourself in that situation now, you do not have to quarantine yourself if you meet a couple of requirements. So the first requirement is that it's been at least 2 weeks since you completed your vaccination series, because it's felt at that point you reach peak immunity from the vaccine. And then they say that it's been less than 90 days since you completed your vaccine. That's because we're pretty confident that the antibody levels will last for those 90 days. We're even actually confident that it'll last beyond that, but we're just not sure at this point. So we're still collecting data on exactly how long this immunity will last. Because remember, we're still not that far out from the completion of the clinical trials, right? So as time goes on, we'll know more about how long this immunity actually lasts. But until we have more information, we're going to work with a 90-day timetable. I'm sure once we get more information, it'll turn out to be longer than that. But that's what the CDC is looking at right now.
I have a question. Can you hear me?
I can hear you.
Thank you. I received my first Pfizer vaccine on Saturday. I'm grateful that I got it. I do have a friend who's on prednisone, and she was told that she cannot get the vaccine. Why is that?
So the reason that they probably did that is because prednisone, being a steroid, is one that will interfere with the immune response. So that may be the reason why they were hesitant to give her the vaccine, because at this point, as far as I know from the data that's available, we don't have a lot of data on the effectiveness of these vaccines in patients who are getting high doses of steroids that are given, in fact, to kind of shut down the immune system. So that's probably their reasoning for doing that.
And thank you again for Zooming us. This was very informative. I thank you very much.
You're welcome. Does anybody else have any other questions that I can answer?
I
Yes.
do. Do you know of any facilities nearby? We've checked into westchester.gov and everywhere to try to get the vaccines, which has been quite the challenge. Are there any other places you may know of or could suggest trying?
Yeah, I really don't. You know, I think on the, if I'm not mistaken, the governor's website, they'll have information for you, and that's really the best place to check at this point, in addition to your local hospital, to see if at some point they can recommend where you can get it, or if they in fact will be able to get it for you. And the other place that I would check, and perhaps even before checking with the hospitals, is your local pharmacies,
Right.
particularly the CVS's and other well-known chains like that, like
Mhm.
Walgreens, because they have actually been given the responsibility for a lot of the vaccine distribution. And
Mhm.
they may be able to tell you when they anticipate getting supplies that are large enough that they can start opening up availability to larger groups. Many of these pharmacies have already been receiving a large number of doses, but they have been limited to distributions to long-term care facilities and healthcare workers and certain other limited groups. So as that opens, they will be the ones probably where you'll wind up getting the vaccine from. So I would just keep in contact with them in terms of when they anticipate getting a larger number of doses.
Okay. Also, if someone gets the vaccine, so now they shouldn't get COVID, but can they still carry the germ and pass it on to somebody else?
Right. So this has been something that is a concern, and why we have to not change our mode of behavior, at least in the short run, after we get the vaccine, because there is a potential that you can come in contact, if you're not careful, that you can come in contact with someone who has COVID. You can inhale the virus. Now the virus is in your body. It will not be able to harm you because it can't get into your cells, like I mentioned earlier, to replicate. But there still is a potential that you can be a carrier of that virus and transmit it to a person who is not vaccinated, which could be a problem, particularly if that's a older or otherwise vulnerable person for serious illness. So the purpose of the vaccine, really, when you think about it, is not to keep the body from or keep the virus from entering your body. The purpose is to prevent serious illness, hospitalization, and death, right? But that doesn't mean that it's going to prevent you from being a carrier of the virus and be able to still infect someone else. So I think that's something else that over time we will learn more about as we have more experience with the virus and the vaccine.
Thank you.
Sure.
I have one more thing. The flu, every year they say 60 to 70,000 people die from the flu. I think it's ironic that those numbers aren't as high as they have been in the past. Is that because everyone is wearing masks? Because it's
Yeah.
transmitted through the oral cavities as well?
I think that's exactly why we have not seen widespread, forget about the deaths. We haven't seen more than sporadic cases of flu in general.
Right.
And I think that's in large part due to not just the masks actually, but think about it. Masking is going to reduce flu. Social distancing is going to reduce flu. Washing your hands more is going to reduce flu. So all of these things that we're doing to prevent transmission of COVID is going to prevent transmission of just about any other type of infectious material, influenza included.
Yeah, it's interesting.
Doctor, I have a question.
Sure.
How effective are masks if the virus can enter through your eyes?
So the masks are extremely effective. The eye infections with COVID are very rare.
Okay.
Though we are, you know where you're starting to see a lot of transmission through the eye, from what I understand, is on airlines. Because on airlines, people are pretty close together. in a closed space, but they are required to wear masks now. But they
Mhm.
are seeing some ocular or eye transmission during air travel. When you wear a surgical mask or a cloth mask, you reduce the transmission of virus from speaking or coughing or sneezing by close to 50%. What the CDC more recently put out was additional guidance that said you get even more protection from wearing 2 masks. And they specifically say that you can get a tremendous amount of protection if you wear a surgical mask covered by a cloth mask. And in fact, a second ago, I said if you wear 1 mask, you reduce the transmission of virus by 50%. Well, if you wear 2 masks with a surgical mask underneath a cloth mask, you can reduce transmission of virus by up to 95%. So the 2 mask option is becoming something that the CDC is now trying to push in a big way.
Another question, please. I was reading in the Wall Street Journal and in another paper that there is some talk that we could reach herd immunity sometime in April. Have you heard or read anything about that?
Yeah, so I've heard various dates, April included. I don't think that's going to happen, my personal opinion,
Mhm.
for a variety of reasons. The first being that the distribution of the vaccine in order to get enough people immunized by the vaccine route, I don't think is going to be fast enough for it to happen by April, probably more realistically by August for that part. Now, I've made a statement about vaccine availability, but that doesn't mean that all Americans are going to take it. So the numbers I've heard is that we're hoping to have distributed 300 million doses of vaccine by August. All right, that's actually enough to immunize just about the entire country. Keeping in mind that we're not going to immunize children at this point because we're still studying the vaccine for that group.
Mhm.
But even with 300 million doses available, if only half the population feels safe up to that point in taking the vaccine, that's only going to leave you with about 150 or so that are going to be immunized by that route, which is not going to be enough to develop herd immunity, even if you then throw into that group people who are immune because they actually had COVID at some point.
Mhm.
So I'm more realistically hoping that we can get there maybe by midsummer. I think that's more realistic. If we can get there by April, though, that would be great, but I just don't see that happening.
How safe is air travel?
Right now, air travel is not safe. Well, let me just put it that way.
Mm.
And it's not necessarily because of your time spent on the airplane.
Mhm.
It's because of the time spent in the airport,
Mm.
where when you're going through security, it's very hard to distance yourself from others. When you're doing that final stand in line to wait to be boarded on the plane, again, very difficult to keep your distance from others.
Mhm.
So it's not so much your time spent on the plane as it is your time spent at the airport. That's a problem.
Thank you. I
You're
found
welcome.
this extremely informative.
Thank you. Thank you. Any other questions? If not, I want to thank you all for joining me. You've been terrific. Thank you so much.
Thank
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 you.
you. It was
you.
very informative.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks.